So when it comes to varicocelectomy, which is surgery, and embolization, which is the coil operation, which is coil radiology, when it comes to these two procedures, why do I say that the benefits are not certain, but the risks are very real? Why do I say that? Well, you have to consider that there's actually pretty good scientific consensus right now on the benefits of varicocelectomy and embolization. Right? Surgery and embolization, there's pretty good consensus overall on the benefits. The meta-analysis that have come out say that surgery and embolization are either not effective, or they help 1 in 7 men or 1 in 17 men who undergo the procedures. 1 in 7 men for surgery. So surgical procedures, for every 7 men who undergo a surgical procedure, this is the NNT, the number needed to treat. For every 7 men who undergo the procedure, only 1 attains a improvement in pregnancy rates, attains a successful pregnancy. So the other 6 men who just underwent surgery will not attain a pregnancy benefit. Right? So obviously a 14%, that's 1 in 7, that's 14%. So that's not a very certain benefit. Right? That is an uncertain benefit. But the risks of surgery are very real. Like, you're cutting, there's local anesthetic, there's cutting, there's an incision, there's getting in there, and there's cutting, and then there's kind of getting out of there as well, right? And there's healing, the healing process. There's lots of different points at which there's high risk. And we're talking about the problems caused by anesthetic. We're talking about bleeding possibilities. We're talking about arterial ligation that could result in a loss of testicle. We're talking about 14% improvement in pregnancy rates, but 1% chance of losing your testicle. Right? Maybe we should be looking at different procedures and different methods of improving our fertility if it's only 14%. Right? That's why I'm saying. The benefits are uncertain, but the risks are very real. And we're talking about hydrocele formation. We're talking about maybe testicular shrinkage after atrophy of your testicle. We're talking about nerve damage that could possibly result in a loss of function or a loss of sensation. Right? That's from surgery. From embolization, you have the damage that the catheter causes to the veins during the process of getting to the right location to release the coils. Right? We're talking about coil migration that could result in loss of testicle. 1% chance again. Right? These are real risks. We're talking about X-ray dye being injected in a location so that they can visualize where they're putting the coils, which means they're targeting with the coils. Right? And then this means that they're using X-rays. So there's X-rays being used to visualize the location that they're targeting. So there are real risks. And you have to treat it like that. And the benefits for embolization is 1 in 17 men who undergo embolization attain a pregnancy benefit. And that's very low. That's just, it's almost negligible. So I would say, why not just improve your lifestyle, right? If you just do some cooling treatments, that will get you similar benefits. If you start taking some supplements, that could give you similar benefits. If you improve your lifestyle, of course, that will give you better benefits. So that's what I really focus on. And I call that natural treatment. Natural treatment meaning that this is everything else that you can do other than surgery and embolization, right? So what are the benefits? Let's keep continuing. What are there benefits for surgery and embolization for pain relief? And the answer is actually we don't know 100%, but maybe there's some potential benefit for surgery, from surgery for pain relief, but probably not for embolization. But these procedures can also cause permanent pain, right? Permanent pain. I have had some clients that have permanent pain from these procedures, right? And there's also a chance of these procedures failing, right? Now moving on to testosterone, right? Testosterone. There's some evidence that surgery might improve testosterone. There's some evidence that embolization might improve testosterone, right? But you gotta ask yourself, why is your testosterone low in the first place? Is it the varicocele or is it poor lifestyle? And I've helped many, many clients, and it's almost never only the varicocele. They usually almost always have poor lifestyle. We're talking about they're inactive, they stopped exercising, they sit most of the day, they have poor diet, they don't take good care of their health, they smoke too much, they drink too much, right? They have some mix of these risk factors for low testosterone, and they're not managing them, right? So why would you expect that the embolization or surgery is going to give you great benefits? If you don't correct the lifestyle, you're not treating the root cause. You're just treating the symptom of varicocele, right? So you have to really focus on what the real problem is, and that's the real solution, right? And can you get benefits can you improve your testosterone naturally? Yes. If you're inactive and you become active, that multiplies your testosterone. If you have a shit diet and then you improve your diet, that multiplies your testosterone, right? So it's better to be more refined than surgery or embolization. What are my options? Should I have surgery or embolization? No, there are many, many, many other things you can do. And that's why I've been trying to educate the internet and all of you guys about for the past 5-6 years that I've been working on varicocele healing. There are other options. You need to focus on everything that you can do and not be stuck on surgery versus embolization, because there are options. Now, I'll link to I've researched this stuff a fair amount. I've gone through many, many scientific articles to kind of pull together for you guys a list of the benefits and the risks of varicocele surgery and embolization. I'll link to the webpage on the description of this video, and you should check it out. Look over it, read over it. Before you really commit to having surgery or embolization, why don't you become more informed about what the real costs and benefits are? Or you can just do a quick NNT, number needed to treat. Quick Google search for NNT of varicocele surgery. The NNT is the number of people it takes to attain a benefit of treatment. You'll see it for yourself. There's lots of scientific publications that say 1 out of 7. The NNT is 7 for varicocele surgery. The NNT is 17 for embolization, right? So what you need to do is become more informed before you make a decision that could result in some permanent damage, right? And really, when you look back on it, it's like, why does varicocele redevelop after surgery or embolization? And the answer usually is, look, you didn't manage the lifestyle risk factors that caused varicocele to become swollen in the first place, right? You still have those crappy lifestyle risk factors that you need to address, right? So that's what my natural treatments are about. They're nothing weird. They're nothing complex. And they're basically lifestyle changes. They're at-home treatments. They're exercises, right? So that's what I recommend. Visit my website. Trust me, I have great resources for you guys. I have 100 free treatment tips to help educate you guys about the real risks and benefits of surgery and help you get really deep insight into why you have varicocele and how to treat it at home. I have 100 free treatment tips. Literally 100 treatment tips for free. And I put a lot of effort into this. It took me a long time to make this free course for you guys. It's just a free course. You just type in your name. You can't even enter a fake name. You enter your name, first name, last name, and email. The email has to be correct because you need to get the emails, right? And you'll just get some treatment tips every day for 30 days. And that's what it is. And I have some great paid premium treatments, and they help a lot. And I've helped many, pretty much I get an email at least a few emails now, actually, every day, thanking me for helping, from guys like you, thanking me for helping them attain good results without surgery, or from guys who've had surgery before, who've attained some benefits, who developed permanent pain, who now have attained some pain relief, who underwent surgery but their varicocele redeveloped, that persistent recurrent varicocele after surgery because they didn't correct the lifestyle, right? Or they had pain after surgery, or they had infertility after surgery, and the surgery didn't give them the benefit that they wanted, right? So my treatments, which is, like I said, the lifestyle changes, at-home treatments, exercises, these things help a lot. They really target the root cause, and I try to really get you focused on all the strategies, the best strategies and solutions, everything that you can do to improve your fertility, to reduce the varicocele swelling, and to cure the pain. And now, I'm not saying my treatments are 100% cure, and the results obviously vary, but they're pretty damn good is kind of the consensus so far. So I'll provide the resources I talked about in the description below. That's going to be the table that contains all the risks and benefits of varicocele surgery, the 100 treatment tips, sign up, and my premium paid treatments. Take a look at all of them. Why not? This is the best resource you've got for varicocele natural treatment or varicocele treatment in general. So that's it, guys.